All right, and DD India correspondent Sam joins us from Kochi for more details. Sam, could you provide more details on the characteristics of the JN.1 subvariant and how it differs from the original SARS-CoV-2 strain? Sam, you're not audible.
Yes, can you hear me?
Yes, please continue.
Yes. As you said, according to the latest reports from the Union Health Ministry, the daily number of COVID patients in Kerala has exceeded 300. 3 deaths due to COVID have been reported in last 24 hours in the state. There are currently 2,341 COVID patients in the state. The COVID figures coming out now are in such a way as cause a serious concern in the state. In the last 24 hours, 358 people have been diagnosed with COVID-19 in the country. It is a matter of concern that 300 cases are from Kerala. The Health Minister, Veena George, attended the review meeting yesterday called by the Union Health Minister.
Okay.
In that meeting, the Health Minister informed that the situation in Kerala is under control. Kerala Health Minister Veena George said that there is no need to worry even though the cases of COVID are increasing in the state. State Health Department had taken measures to manage the present situation. To answer your question, JN1 variant growth indicates that it is more transmissible or better at evading immune system. Currently, there is no evidence that JN1 presents an increased risk to health compared to other variants, and also no indication of increased severity from JN1.
Okay.
According to the health department, only one of the samples from the patients sent for whole genome sequencing and returned positive for JN1. Other patients are COVID positive only. The JN1 patient was a native from Thiruvananthapuram, and he is cured now. Meanwhile, the opposition leader V.D. Satish accused the government of trying to cover up the spike in COVID cases, citing reports by the Ministry of Health. He said 85% of the cases in the country had been reported from Kerala.
All right. And Sam, are there any identified factors contributing to the rise of COVID-19 cases in Kerala? And what is the overall strategy to mitigate the impact of emerging strains in the region?
Yes. Kerala Health Minister Veena George said because of the tremendous spike in fever cases, COVID testing rate also increased, hence positive cases being reported as well. In the increase in number of COVID patients being reported from Kerala is due to the more number of samples being tested in Kerala, and everyone who shows symptoms are undergoing COVID test. Meanwhile, the opposition leader accused that government is hiding the real situation. The government is purposely hiding the real situation. All the 21 ministers, including CM and Health Minister, traveling all over Kerala to showcase the achievements of the state government because of the dogs, to showcase the achievements of the state government. There are 140 public meetings arranged and huge gathering of party activists is going on. He also stated that the ruling party is trying to build up the public imagery before Lok Sabha election, and they are gambling with people's lives in their hands. BJP State President K. Surendran asked the government to take immediate measures before people start panicking. Government, the health minister says that there is nothing to worry in present situation.
All right. And what public health guidelines are being emphasized to the general population to prevent further spread of COVID-19, Sam?
Yeah, Presently, there is no public restrictions imposed by government to passengers or to the public. But government gives strict instructions to the hospital authorities and hospital health department staff that all the inpatients and outpatients and all the hospital staff should wear the mask, and there is no mandatory instruction to the public that any kind of mask wearing or anything like that.
All right. Thanks for all those details, Sam.